This episode is brought to you in partnership with Baby B, award-winning prams and baby essentials, trusted by thousands of Australian families.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Well, welcome everyone. I'm Brigid Maloney, and this is part 2 of our breastfeeding special with Dr Kavita. Now, I want you to go back and listen to part 1. It's got some basic tips and tricks and how to set yourself up for a good latch and what some myths around breastfeeding are. But perhaps you picked this episode up because you think you might have mastitis, and that's completely fine too. Have a listen, and then if you need some further explanation of a few things that Kavita says, just go back and have a listen to part 1 also. So my sympathies go to you if you are that woman and you've picked this up because you think you've got mastitis. I hope things are going okay for you. We'd love to hear feedback on this podcast. So yes, you can get into Spotify now and you can give comments straight up. So yeah, we read every one of those and we try to incorporate that back into our podcast that we do for you. All right, everyone, let's get on to the episode and talk to Dr Kavita, Breastfeeding Medicine Specialist, Perinatal GP and IBCLC with over 18 years of medical experience. Well, welcome back, Dr Kavita. I'm so pleased that you've joined us again.
Thanks for having me.
Yeah, the last episode was so great and we've had such fabulous feedback from it. So we're going to give people sort of like a concise mastitis, because I know what people will do in the middle of the night. They'll be searching through the catalogue and going, oh my God, have Dr Pat and Brigid ever done anything on mastitis? And they'll pick this up. So this is for the person that wants to know what mastitis is, why they got it, and what are they going to do to help them through the pain of mastitis. So if we start, I think we should really start at the basics. And could you tell us what is mastitis?
Yeah. Mastitis, we had a new protocol that was released in 2022 and it's revolutionised our understanding and management of mastitis. Mastitis is part of an inflammatory spectrum. So we actually now call it the mastitis spectrum. And it covers things from, blocked ducts, painful lumps, to the end of it being mastitis, and then further things like abscesses and, granulomatous mastitis and things like that. So it's really important to understand that it is not just boom, one thing, that there is a pathway that gets you towards a tendency towards mastitis. So, yeah, that's the...
Because we used to think it was an infection and people would go into their doctors and get antibiotics. So is that just not... There's no infection involvement anymore?
Yeah, so it's caused by inflammation. It's caused by milk stasis. So we're not removing that milk frequently enough. And what happens then is you get a pressure effect. So remember those lactocytes we were talking about? If they're overfull with milk, that causes a pressure effect on that tissue surrounding it, and that causes swelling in that area. So it's not actually within the glandular tissue or the duct necessarily where the problem is. It's actually in that surrounding tissue. If that milk is not released or removed, we end up perpetuating that problem, and that swelling just increases. So the way I explain it to patients is it's like a bruise. So if just the way you've got, a bruise on your arm, if you had a bruise on your breast, would you sit there and massage the bruise out of your arm? No, you wouldn't dare. And the same thing with the breast. And I say this as someone who before 2022 was doing it. We were telling everybody to do it because that's what we thought. It was based on not understanding the physiology and the anatomy of the breast, as well as Dr. Katrina Mitchell and the ABM. They released this protocol, and it's just made... It never made sense to me. Breast milk has antibacterial properties. How is everyone getting mastitis? So it just didn't make sense. But regarding the antibiotics, with my patients, I always give them a script for the antibiotics so they have it on board. Because if you know mothers do not want to take anything. They don't even want to... I had somebody say they didn't want to drink tea because they were worried about how it would affect their baby. And they will not take a medication unless they are in dire need of it. So yes, I know it can affect the microbiome and all that, but the amount of the antibiotic that goes into the breast milk is minimal. And if a mother feels that she needs to take it, take it. Okay. But know that that's not going to solve your problem. It has an anti-inflammatory effect as well. So that could be why it suddenly feels like it's settling down. It's not because it's actually managing the bacterial infection. So the key things to know is that mastitis will almost always be preceded by blocked ducts. And do you want to know?
No, I want to know what that. If you could describe what a blocked duct feels like for the first time parent.
Yeah. So what we used to say is clogged duct. Because again, we were under the misguided idea that there was actual clogs of milk within the ducts, and they weren't able to get out, and it was an obstruction. This is not the case. We know that a blocked duct, it's that tissue around it which may be blocking the duct. So if you had a little narrow pathway and then you've got suddenly, traffic, you can look at it as a traffic analogy, and then suddenly everything is pushing in, that can't flow properly. No, the traffic analogy doesn't work. But it's basically surrounding tissue around it has a lump, and that's the blocked area that you're feeling. It's not actually within the duct when we say a blocked duct. It's actually, there's a blockage around the duct, which is affecting the flow of milk from that alveoli out through the nipple wall.
So in part one, you talked about like fat. Is that what the tissue is that's blocking or narrowing the duct?
The stromal tissue. So it's kind of stromal tissue. Yeah, it could be fat. It could be any of those kind of things there. Yeah, I simplified it in that one. But this stromal tissue is just kind of the tissue that is in between that kind of area. So that's the tissue. Exactly, though. That's exactly what we're talking about. And that's what causes the bruise. It's like, if we get a bruise in our arm, there's muscle, there's stromal tissue as well. So again, that you could get a bruise in your muscle in your arm as well. But anyway, the purposes of this discussion, it's the stromal tissue usually. And we know this as well from ultrasound. So what I will do if the patient is not so common now, but in the early days when we were transferring into this protocol, also to back myself, because there aren't many of us practicing breastfeeding medicine, and I didn't want to miss something, A, but B, also I wanted to be sure of what I was saying. So I would ultrasound, and there was never a collection there. There was never a bacterial, if it was an abscess or a bacterial collection, we will see tissue changes. We see a different color, we see different things. And it wasn't that. It was actually just generalized inflammation. And so the key thing for people to understand is that anything that causes pain in the breast is usually due to inflammation of some sort. Now, then we have to go down to what is the cause of that inflammation. Is it the lack of removal of milk from the breast, or is it other things? So for example, if you had nipple damage, you're going to have inflammation. Let's say, what we were discussing earlier, the nipple damage on the nipple openings. If you've got cracked nipples, anything like that, wherever there is a cut, your body will be desperately trying to heal it. So it'll be sending, different cytokines, different things, like whatever it is, to try and heal that tissue. And that can cause inflammation in that area too. But the most common cause of mastitis is not removing that milk correctly.
How does that work in an oversupply? Is that oversupply, undersupply? If you're not removing it because you've got milk coming out everywhere, I don't know. How do you get milk stasis?
How do we get there? Okay, so the reason we get there is usually because of these myths of, draining the breast, emptying the breast. We end up making people think that oh no, my breast is full. Oh no, I need to empty it. Whereas what the breasts are usually doing in those first 3 to 6 weeks is they are working it out themselves. They're incredible. They're trying to regulate the flow themselves. So when that first bit when your breasts become like rock hard, that's all of that alveolar congestion, edema, like all of this kind of thing as those glands are activating, right? Because your lactocytes aren't functional actually until after pregnancy. It's incredible. So that's what all that swelling and hardness is. And when that settles down, people panic and they think, oh no, I'm losing my milk supply, because that's the myth, the dominant myths out there, because it's not really based on the science. It's based on all of these people kind of mishmashing things together and coming up with what lactation was, for a while. So what usually happens is these people will feel full, and then they'll think, oh no, I need to drain that, and then that just perpetuates the cycle. when instead what ideally would have happened is you feel full. Okay, if it's painful, put some ice on it. If it's still painful, take some ibuprofen, keep that ice on it. And within 3 days, that pain will reduce because the breast will have adjusted their supply and you won't get that milk stasis. And it can also help with that fast letdown that we were talking about.
Yeah. And how interesting, because most people would think, and I think that was the treatment back then, was if you needed to put your breast on a breast pump to pump out the hardened blocked duct.
Oh, I still think of how many people that I would have said that to. I was in there helping them drain it.
Yes. Yeah. Oh my gosh.
That's what we were
in
doing.
the shower under hot water. Yeah.
Yeah. Yeah. And so it's one of those examples where the lack of it was assumed knowledge. There's so much assumed knowledge in breastfeeding medicine that we need to debunk and start to really go back to first principles, of physiology, anatomy, function, and physics as well. Physics actually comes into this, which is interesting because most doctors, like myself, aren't up to date on our fluid dynamics or how things are synthesized in the alveoli. So, yeah.
So we've talked about pumping being a risk for sort of creating or setting yourself up for a mastitis spectrum symptom. What about other?
I love that you said that. Mastitis spectrum.
I'm already talking about the spectrum. So what about things such as, I don't know, how you hold the baby, feeding positions or nipple shields, or is there anything else that you see us doing that you think, let's perhaps move that out of your feeding regime and let's concentrate on other things?
No. So there would never be a hard and fast rule. There's a place for everything in breastfeeding. And I wouldn't say let me just make sure I'm really ranging through all the things. There's nothing that is going to create mastitis other than artificially creating an oversupply, or if we have damage that we're not resolving and we're perpetuating because it will cause inflammation. So those are the two mechanisms. So, for example, if you have damage and you're using a nipple shield, sure, that can contribute. If you are pumping and you are breastfeeding directly at the breast or with a nipple shield or with any other supplementary feeding device, that can impact it. But again, more because the pumping is creating an oversupply. What a big one is if you have pump damage. Okay, so if we are not using correct fitting pumps. So if we have, I have a diagram which shows the way the shield, the flange should fit over the nipple. The nipple should not be touching the sides. That means it's too small, and you should not be having the areola, which is the other coloured bit, come into that pump because it will cause damage. And the areola damage, it's bad. Yeah.
All right. So you've mentioned that we've got new guidelines, and it's just like recently we did an update on the bulk billing for the genetic screening carrier, and somebody commented, look, can you please tell GPs because they don't know it's bulk billed either. And the information does flow through slowly sometimes, doesn't it, to your healthcare provider. So how do you feel most healthcare providers go in diagnosing mastitis using the new 2022 guidelines?
So I think all my colleagues are amazing and they're doing their best to stay abreast of everything. The problem is that this is not, until now actually, we haven't had any official recognition by any medical colleges of lactation as a science. We have recently, the RSCGP, which is one of the biggest medical colleges in Australia, and I'm a part of, we have a new breastfeeding and lactation medicine special interest group, which is the first time. So now through that, we are going to be able to push the proper guidelines, proper clinical care, proper education, collaboration with other specialties. But up till now, it's kind of just been we've been trying to educate people, but we haven't had a systematic way of doing it. There's also the Breastfeeding Medicine Network of Australian and New Zealand doctors as well. And that's for anybody who wants to be in the field. But it's really only been if people have been interested in it. And to be honest, even though we've got this this breastfeeding medicine lactation SIG, it's still it's not part of the curriculum yet. So I'm doing lectures at UNSW, and I've done it for pediatrics. But again, if somebody wants us to come in, then we come in and do lectures. But there's no obligation to put that in the curriculum because it's not seen as being necessary. So that's our first challenge. And everybody needs to kind of push the colleges, push your MPs. I have been trying to I want to get a postpartum care plan where we have 6 rebatable sessions, and people can use that for lactation consultants, physios, whatever it is. We have a care plan for if you injure your knee, you can, if you've had the injury for a bit of time, not just because you've got one injury, you can access physio and things like that. So we need something like that so that it's accepted in the medical system. So right now, it's going to take time. It takes time for when something is accepted in medicine. It takes about 17 years for it to become common practice. So, yeah, it's shocking, isn't it? Yeah. But with this one, we're even fighting a harder battle because it's not considered, it's slowly starting to be considered, even though it's a board certified specialty subspecialty in America, it's still not considered that way in Australia. And even I've spoken to obstetricians who have been like, oh, well, no, why do we need that? Not the majority. Yeah. I speak to them. Yeah. Oh, yeah. And they're just like, no, it's not a thing. This was an older, person. Mm. But again, I was so shocked, and I was like down for like a week being like, oh my gosh, I'm going to this. And this was 2 years ago. But I feel like the trend is turning, the tide is turning, but it will come from people seeking information and saying it. So if you hear this and you're given different advice, just say, have you heard of the 2022 mastitis protocol? Because they're saying to do other things. And I see people coming in with like being like, oh no, I was told to do this. And I'm like, yeah. And I think it's also important to say I was doing those things too before we had the new protocol.
Well, that's what a new guideline is. Everybody adopts their practice eventually to the new guidelines. And we might put a link in the show notes to those guidelines because I know we'll get some motivated people who will want to read it. And I love that you're championing the 6 visits postpartum. And I just want to point out, the other day I was looking through our, the Medicare billing rates, and our obstetricians, they bulk bill the postnatal visit. And our postnatal visits are about 30 to 40 minutes with the obstetrician and about 30 to 40 minutes with the midwife. And all up, the government pays us or them $42.35. I mean, that is so wrong. You can't even get a plumber to come to your house for that. I just think there's something wrong where people say, oh, I only had a 6-week check with my obstetrician and it was about 10 minutes. I'm thinking, well, that's because, it's bad, but perhaps their rebates need to be better for it to be a
Oh, they definitely do. Yeah. But even in general practice, they're taking away, there's a mental health consultation we do, the 2713. And, I like that one because we're focusing on mental health, and it shows the importance of mental health as separate to your physical symptoms. But even that is now, just put it all as one thing. And we don't have a proper postpartum item number.
No, that's ridiculous. Yeah.
And it's GPs that see 90% of the issues postpartum when it's feeding or for the mum. And the thing is, the mum gets ignored. I make my patients, I bulk bill them, but I make them book an appointment for themselves because I'm like, you need to understand from get-go that your health is important and we need to look after both of you. You can't just look after one or the other. You have to understand them both as a unit.
Back to the unit.
Yeah. Back to the unit. Yeah.
When you become a parent, some things just become an extension of you, don't they? Like your phone, your favourite tote bag, and your pram. It's more than just a way to get your baby from A to B. It's your new ride and your whole life packed into a basket underneath. And that's the exact mindset Baby B designs with. As an Australian-owned and designed brand, they create award-winning prams, strollers, and baby essentials that are ready for your lifestyle. They blend that premium look and feel with total practicality. But the biggest testament to their quality, a lifetime warranty on all prams, because they know a pram isn't just a purchase. It's a partner for your entire parenting journey, from the newborn days to toddler adventures. So if you're looking for the one, explore the full range and shop online at babybeonline.com.
So I want to go back to the mastitis spectrum. So let's say someone has, and what I'd like to do is just go through the symptoms in that spectrum and what someone would notice, and then we'll later talk about the treatment because they might be a bit the same. But so if you could start with the lump in your breast, is that the first symptom? Yep.
That is often the first symptom. Sometimes it can even be hardness of the breast. You can just feel suddenly, once your breasts have already started to regulate, you start to feel a bit of hardness. Okay, have a think about it, and we'll talk secondly what you should do. But then you might notice a painless lump. Okay, that's the next one. Then that lump might become painful. Okay. Then you might notice that it's actually really painful in that particular area, but you may not have any redness, you may not have any swelling, you may not have any further pain. When it kind of goes to that mastitis part of the spectrum, you will notice possibly redness, and in different colours. In my kind of colour, you might notice shininess. You may not see redness in the same way. You still will see red, but it just won't look as florid as on fair skin. And you may notice it will be very tender. Very, very tender to put anything on it. That is also one of the hallmark features. Now, if you get fevers, look, the evidence actually says that within 24 hours that fever will come down. Given my kind of thing, and you may not follow up the patient, and I'm still scared of abscesses because I've been a doctor for a long time and I've seen abscesses due to bad management. I will generally say, look, if the fever persists, take the antibiotics, but the evidence doesn't say that you need to do that. And I'm being slow to change on that. But the thing is, parents know. Usually, this will take place over 5 to 10 days, usually, and you can so you have many opportunities to reverse that kind of pattern if you know about it. If you don't know about it, it just goes from painless lump, painful lump, blocked duct, mastitis.
And what about abscess? What is that? Is that part of the spectrum?
It is. It's the far end of the spectrum, where if you can have repeated, some people have a predisposition, and there will be a bacterial collection that is it's a lot more rare than we've realised, than what we previously thought. So there are many people that I have, and again, they've come to me because I do this, and they're like, it's so bad, and I'm like, it must be an abscess, and I go looking for it. And it's not, but usually if you have an abscess, you will have had repeat episodes of mastitis. It is when it is not being resolved the correct way, which means we have to change the offending factor.
And I'm a bit confused. I've never seen an abscess. Is it something that's internal to the breast and the skin, you can't see it, or is it something that is sore and open?
It can be both, but most likely it's going to be internal. Yeah.
Yeah, right.
But we shouldn't put too much of a focus on that.
No.
Yeah. So because that's just going to terrify everyone. But again, if we manage it early, we won't get to the point of mastitis. But however, if it's persisting, it's pretty simple in Australia. We're lucky that these things are billed, that we can just get an ultrasound and make sure that there's not a collection that needs to be drained or anything like that.
Great. All right. So now let's talk about the treatment on that spectrum. So somebody has just hard breasts, or they've found a bit of a lumpy bit. Let's start there and then we'll work our way up.
So if you have, and it's a sudden onset of these things, because it is Breast Cancer Awareness Month as well, so we'll do one little thing on that right at the end. But let's say you've noticed a bit of hardness in the breast, and then you've noticed a lump. The first thing you're going to do, even at the hardness, because it's uncomfortable even then, is you're going to put ice on. And did you ever hear about how they used to have cabbages in maternity? So it's so clever. I love all these old wives' kind of tales. But the cabbage has a really high water content. So if you put that in the freezer and you take out a leaf, you've essentially got an ice pack, right? So they were doing the right treatment anyway for this engorgement and this kind of inflammation the natural way, but an ice pack is going to be more effective. So you can get those little ice packs where you can section them and you pop it on that area. No massaging, no draining, just treat the breast with
no
respect.
Heat.
And no heat, no. Yes, heat is out, okay? Heat, we know heat exacerbates inflammation. So always think about it. If I had a bruise on my leg or my arm, what would I do? You'd put ice. You would never put heat on it. So you put that ice on it, and if it's still really painful, you can take ibuprofen. If it's still persisting at that point, see your doctor and make sure that there's nothing else going on, and go from there.
Yeah. And what about our physio at work has done a whole lactation, physio lactation course, and so she offers ultrasound. What do you think about that?
I think there's a place for it, but we've got to fix the cause of it first. So if we get it early and if the first sign of symptoms, we don't need the ultrasound, we don't need the lasers. And that's generally my principle with everything in breastfeeding medicine. If we get it early, we don't need all the external things. You don't need the lanolin, you don't need the nipple creams, you don't need the silver cups, you don't need anything other than yourself, the body, some knowledge, and support. Those are the things that you actually need. A few pillows helps. A good baby carrier also helps. But so the ultrasound, it can be great if, let's say, what often happens is patients get nervous in the middle of the night. They're like, it feels too engorged. I'm just going to drain it, Because the other thing that we haven't discussed at all here is when you tell a mum that she's making too much milk, we're both mums, right? I would be like, you're insane and you're a danger to me and my baby, and step away, right? Until that's the thing. We're so driven to just feed, make more milk, make more milk, make more milk, and that's an instinctive response. So it sometimes takes people a bit of time, but they start to see the difference when they practice this. If they put the ice on, you will see an improvement. But if let's say, you panic in the night and then you pump, it's just going to make it worse. It takes 3 to 5 days, everything with the breast, to get better. But you should notice a decrease in that kind of redness, in the pain. The redness that you often see with mastitis, we all thought it was, bacterial infection. It's actually just hyperemia. And again, Katrina Mitchell does a whole section on this. It's actually just the same of boom, if you did something and you got redness. It's the same thing. So redness doesn't always mean we need antibiotics. Get it on board. So if you panic at 2 a.m. and you think you have a fever, take it. It's not going to cause harm. Yes, I know it disrupts the microbiome, but so little gets into the breast milk, and it's not an issue. I have no problem with people taking it, but just know that it's not going to solve the problem. That's the key thing.
The problem being solved is seeing perhaps a lactation consultant to help get your position and latch right. Is that what you're getting
it's
at?
Actually the main problem is the understanding if you're removing the milk correctly or if you are over pumping. Most of the time with blocked ducts and mastitis, we will see a pump involved.
Yeah. All right. So I'm going to ask about the people that get recurring mastitis. What would you suggest for them?
For them, the same protocol. We've got to use ice, ibuprofen, and anti-inflammation is the way we're going. But speak to your doctor. If it keeps happening, for me, my kind of way I practice is if it happens twice, I will do an ultrasound just to make sure that we're not missing anything. But to be honest, when I think I get a particular type of patient as well, like they're already tuned into half the information, they just want confirmation. So I don't really get ones that progress further than that. Yeah. But it is really important as well for people to know, if you notice a hard lump that doesn't seem to go away, a pea-sized lump, anything like that, you need to speak to your GP, get a mammogram, make sure that there is no contraindication to mammograms just because you're breastfeeding. Really, really important because it's Breastfeeding Awareness Month, but also just really, really important anyway to never neglect breast health, including awareness about breast cancer too.
When you become a parent, some things just become an extension of you, don't they? Like your phone, your favourite tote bag, and your pram. It's more than just a way to get your baby from A to B. It's your new ride and your whole life packed into a basket underneath. And that's the exact mindset Baby B designs with. As an Australian-owned and designed brand, they create award-winning prams, strollers, and baby essentials that are ready for your lifestyle. They blend that premium look and feel with total practicality. But the biggest testament to their quality, a lifetime warranty on all prams. Because they know a pram isn't just a purchase. It's a partner for your entire parenting journey, from the newborn days to toddler adventures. So if you're looking for the one, explore the full range and shop online at babybeonline.com.
Thanks for mentioning that. I recently found what I thought was a lump, and Pat doesn't often say anything in a hurry, but he goes, I'd get that one checked out. And it was really stressful. And I went to have my mammogram and it's all clear. But the relief that you get from an all clear, it's really worth doing. So, yeah, I'm really glad that you mentioned that, particularly because it's breastfeeding month. That's great.
But also, just if you get the all clear but you still feel nervous, don't accept the answers there as well. Trust those instincts. Get further imaging. We now have different guidelines as well. So because sometimes we can't always see it usually under 40, we need a breast ultrasound. So we might need a mammogram. We now have breast MRI, which I don't know if people are aware of. So if you suspect it, speak to your doctor. Doctors don't want to miss things either. So they can send you on to your breast surgeons and they can give you the best advice, the best imaging, and go from there. Don't sleep on this. Advocate for yourself. And always check yourself for lumps. Yeah.
In my case, my lump has gone, so I feel like I'm fine.
Good. Yeah, it's so stressful.
Yeah.
And I think talking about it normalizes the fact that before I was in medicine, you don't know, like that, like it feels lumpy. Like, how do you know? So you're not supposed to know. You go to your doctor. They're used to feeling breasts, and even if they're not, they can image it, and then we can get more answers for you. You don't want to be sitting there being like, if only I had gone in when I thought that. That's the key thing.
Kavita, you've mentioned the microbiome a couple of times. You mean gut microbiome? Is there a microbiome or on your nipple, or what do you mean by that?
There's microbiome everywhere. We have a respiratory microbiome, we have nasal microbiomes, we have an oral microbiome. It just means the living organisms in a particular area. And we, of course, the big one is the gut, which we now know is 80% of our immune system. It's incredible. So the reason I mentioned microbiome is because microbiome, it's a bit of a fixation out there in the community at the moment. But again, like everything, we've got half information out there. So the microbiome is hugely important, but there are lots of natural ways of improving your microbiome. It doesn't always have to be an expensive supplement because those supplements are super expensive.
In terms of the breast then, like, do we have to work on the microbiome? Is that a part of mastitis?
Yeah, so there's this is something where it's part of, you'll see this in the protocol, it's called the dysbiosis. So if we treat with antibiotics, we can affect the microbiome of the breast. But then again, this is something that your doctor should really be talking to you about. But what we mean is there are always organisms. So just like on our skin, we have Candida, we have strep organisms, we have all sorts of different organisms that are on our skin, and the same thing for the nipples and the breast. And different types of skin will encourage different types of organisms. So you didn't ask this question, but nipple thrush is another one that, I think hopefully it's out of fashion now, but again, the evidence doesn't support it. We've had everybody that had painful red breasts was told, the typical thing we were told, even in medical school, and is that if somebody finds that even a T-shirt too painful, we treat them for nipple thrush. And again, I don't mind people being treated for things if they need it, but it's an arduous treatment. You have to take, you have to put a gel on your breast. You have to treat baby. Sometimes you have to take an oral medication, and the big issue I have is it doesn't fix the problem. So, yes. I've segued away from it. Yes, there is a breast microbiome. The microbiome contains lots of organisms that are supposed to be there, so we don't want to alter it.
And so if we feel like we've altered it because we've taken antibiotics, do we have to do anything to increase our microbiome?
No, it will self-correct. It will self-correct. As long as you have a healthy, balanced diet, good habits, it will self-correct. That's the amazing thing. I get... should I go and buy a probiotic and give it to the baby? And do you know what the third most prominent part of breast milk is?
No.
It's something called human milk oligosaccharides. So these are little sugars that feed our gut microbiome. So it's the third most prominent part of more than your fats, more like, well, it's not more than your fats, but it's more than one particular fat, let's say. So it's so important that the design of breast milk, again, that incredible design, makes so much of this so that we can feed and encourage the growth of certain species. So certain species are really good for immune health. So what they need to know is you don't need to buy something from out there. Your microbiome is coming from your breast milk, and it is far superior than anything you can buy.
Let's say somebody has mastitis and they're worried about what to do in terms of feeding their baby. Do they not feed off that breast, or do they continue feeding? What's your advice there?
You feed as normal. So you don't want to try and feed to drain. You see people saying dangle feed to try and release it, all these kind of things. You don't want to do anything different to what you'd be doing. Feed as normal as what baby needs. You cannot empty a human breast. There is always residual milk in it. It's a ductless system. It's not a cistern like dairy cows. So it cannot be emptied like that. The things not to do: no heat, no massaging, no trying to drain it, no trying to massage towards the nipple, and definitely no trying to feed to drain the lump. No gentle massage even, because that adds to inflammation. The things you can do: ice, ibuprofen. You can, if you're really uncomfortable, you can do gentle lymphatic massage, which is just like gentle skin pressure, nothing else. Not deep in, you're not massaging anything, and you go away from the nipple towards the armpit. But that's the most of it. And see your doctor if you're concerned.
Wow. Thank you so much, Kavita. That is a great sort of 101 mastitis. And again, going back to your whole thing of it's a team approach. Like, you need to be supported through this. So you're getting support from your partner if you have one, or a mother or mother-in-law. I'll only be a mother-in-law. If you need, and they're good support, and finding a good GP and perhaps a lactation consultant, reach out to your contacts, because I don't think anyone should go through mastitis alone.
No, a breastfeeding medicine doctor as well. So,
sorry, that's what I meant. There's not many around, though, are there?
We're growing. I think there's many, but we're not connected yet. So there's quite a few that are interested, and in the next 2 years, like, watch this space, it's going to change. People are interested. We're not accepting the status quo and how ignored it's been. So, I think the big long-term things are going to take a while, but, we're making small moves. And things like what you're doing, so important. You're doing the same things, like you're just keeping people informed and answering those questions that they have, because we just don't know in medicine. Until I came onto doing social things, I had no idea what was bothering people, because you just don't have, you only have your small appointment windows to work things out. So, yeah. But thanks for all the amazing stuff that you've done.
Oh, you're so kind. You're so kind. All right, Kavita, thank you so much for your time, and I hope we keep in contact over the years. I'd love to see what happens with breastfeeding medicine. We'd love to get a breastfeeding medicine at our clinic. That would be amazing. All right, everyone, I hope you got a lot from that episode. We've got a few things that we need to put in the show notes, so if we've mentioned something, just go and have a look in your show notes and see if they're there, so you can click on them and have a read up as well. All right, until next week, everyone, bye for now. Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
This episode was brought to you in partnership with Baby B, award-winning prams and baby essentials trusted by thousands of Australian families.